It may be a bleak Christmas for residents in the metro. The number of positive cases in the Nelson Mandela Bay metro is on the rise. Health officials fear with the festive season around the corner, numbers may spiral out of control. The Nelson Mandela Bay metro now accounts for 55% of the country's new infections at over 7,000. The super spreaders, such as social gatherings, are seen as the main drivers behind the surge.
Our concern is that something has to be done. We need to find ways of prevailing over the situation in the Nelson Mandela Bay. We have seen the numbers of positive cases increasing. Nelson Mandela Bay and Eastern Cape. We have seen the number of people admitted in hospital has increased. The numbers of people who are recorded to have lost their lives has also increased. The percentage positive cases has also increased. So by all counts, this is an indication of a resurgence. The debate now is to what extent are we able to contain it so that it doesn't spread to other parts.
The minister will spend the next 2 days overseeing efforts to curb the transmissions of the virus. Key to fighting these transmissions is community engagement, something that will also form part of the minister's visit.
First spreaders identified by the authorities is that it is social gatherings, and that is where we are zooming in as a city. And to a certain extent, we have been engaging with the religious sector as well as the tavern owners, just to make sure, because those are the ones currently that are having gatherings. You might know there are regulations that says if a building capacity is this much, you can take half. We are looking at maybe how best do we work together even on the half number now, because the numbers are growing.
Another important aspect that has been stressed by the minister is the importance of encouraging people to test. Rapid testing in every ward of the metro, and the importance of prevention, contact tracing, isolation, quarantine, and the early presentation to hospitals are the key messages this week. A shortage of staff remains problematic, especially doctors in hospitals, something that the human rights organization Gift of the Givers is helping find solutions to.
We're also looking at staff. We've recommended paramedics. Paramedics are highly trained. They can do the work that's required in a COVID-19 situation. But it's not a diagnosis. You already have the diagnosis. You need management of oxygen, of drips, of high flow machines, and the monitor who requires to go onto a ventilator. Paramedics can do an excellent job. So we're looking at that facility also. Currently in the Eastern Cape, besides the metro here, we're busy supplying PPEs to 40 hospitals.
On Friday, the minister is expected to visit hotspot areas as well as the VW field hospitals. Lerato Fekisi, SABC News, Port Elizabeth.